Welcome to our Hatha Yoga Ashram. Today, we have come up with a new topic about mindful movement during pregnancy, prenatal yoga tips for well-being. Let's start. Pregnancy is a time of constant change physically, emotionally, and mentally. As the body adapts to support new life, familiar movement patterns shift, energy levels fluctuate, and the nervous system becomes more sensitive. Prenatal yoga, when practiced with awareness, offers more than gentle exercise. It becomes a way to listen, adapt, and cultivate trust in the body's intelligence. For teachers and beginners alike, understanding mindful movement during pregnancy is essential for supporting well-being rather than chasing form. Understanding the purpose of prenatal yoga. Prenatal yoga is not a modified version of a regular yoga class. It is a distinct practice with its own intention. The primary goal is not flexibility or strength in isolation, but stability, comfort, and nervous system regulation. A safe pregnancy yoga practice supports circulation, breath awareness, and emotional grounding while respecting the changing biomechanics of the pregnant body. From an expert perspective, prenatal yoga is most effective when it helps practitioners slow down and feel rather than push and perform. This shift in intention often brings relief to both body and mind. The role of mindful movement in pregnancy. Mindful movement means moving with attention rather than habit. During pregnancy, joints become more mobile due to hormonal changes, especially relaxin. While this increased mobility can feel freeing, it also raises the risk of overstretching. Moving mindfully encourages pregnant practitioners to sense stability before depth. Small, controlled movements, especially in the hips, spine, and shoulders, help maintain joint integrity and reduce strain. This approach supports long-term comfort rather than short-term sensation. Breath as the foundation of prenatal practice. Breath awareness is central to prenatal yoga, yet it must be approached gently. Rather than breath retention or strong techniques, emphasis should be placed on smooth, steady breathing that encourages relaxation. Deep, relaxed breathing supports oxygen flow, reduces tension, and helps manage emotional fluctuations. For teachers, cueing breath without force is key. The breath should feel supportive, never demanding. This mindful breathing later becomes a valuable tool during labor and early motherhood. Adapting postures for a changing body. As pregnancy progresses, balance, posture, and center of gravity shift. Standing poses benefit from a wider stance and the use of props for stability. Twists should remain open and gentle, avoiding compression of the abdomen. Backbends, if practiced, should be subtle and supported. One of the most valuable prenatal yoga benefits is learning when to modify or skip postures altogether. Restorative poses, sideline relaxation, and supported seated positions often provide more benefit than dynamic flows, especially in later trimesters. Supporting the pelvic floor with awareness. The pelvic floor plays a crucial role during pregnancy, birth, and recovery. Prenatal yoga helps cultivate awareness rather than constant engagement. Over-tightening can be just as problematic as weakness. Mindful movement encourages coordination between breath and pelvic floor response, softening on inhalation and gently engaging on exhalation when appropriate. This balanced approach supports strength, flexibility, and awareness without strain. Emotional well-being and nervous system support. Pregnancy often brings emotional sensitivity alongside physical changes. Prenatal yoga provides a structured space to observe these shifts without judgment. Slow movement, grounding postures, and longer relaxation periods help regulate the nervous system. For teachers, creating a calm, predictable class environment is just as important as the sequence itself. Consistent pacing and clear language foster a sense of safety, which is essential for emotional well-being during pregnancy. The importance of rest and recovery. Rest is not an optional part of prenatal yoga, it is a central component. Fatigue is a natural part of pregnancy, and mindful practice respects this reality. Incorporating pauses, supported rest, and shorter practice sessions helps prevent burnout and supports sustainable energy. Encouraging rest also reframes productivity. Rather than measuring success by effort, prenatal yoga values responsiveness and self-care. This mindset supports both physical health and emotional resilience. Guidance for teachers working with pregnant students. For yoga teachers, prenatal classes require a shift from demonstration to observation. Each pregnancy is unique, and assumptions can lead to discomfort or risk. Clear options, simple cues, and permission to rest empower students to make informed choices. Teachers should also maintain professional boundaries, avoiding medical advice while encouraging students to consult healthcare providers when needed. This ethical clarity builds trust and long-term confidence in teaching prenatal yoga. Integrating prenatal yoga into daily life. The true value of prenatal yoga extends beyond the mat. Mindful posture during daily activities, conscious breathing during moments of stress, and awareness of physical limits all support well-being. By integrating these principles into everyday life, prenatal yoga becomes a companion rather than a scheduled activity. This continuity prepares practitioners for childbirth and the transition into parenting with greater confidence and calm. A thoughtful closing. Mindful movement during pregnancy is an invitation to slow down and listen deeply. Prenatal yoga, when practiced with awareness, supports strength without strain, flexibility without force, and calm without suppression. For beginners and teachers alike, honoring the body's changing needs fosters trust, resilience, and a grounded sense of well-being that extends far beyond pregnancy itself. Thank you for listening. Please stay connected with us at arhatagga.org.